This is a profile of Neal Patterson, who's the founder and chief executive of Cerner, which is the largest standalone company that sells health information technology. This is actually a pretty small business, but it's been a big part of what is changing right now in healthcare. And increasingly, hospitals are really, because of financial incentives put in place in the stimulus bill, which is one of the first things Obama signed, they really have to put in systems for ordering drugs using a computer and systems for keeping track of electronic health records, electronic medical records. Obviously, everyone's very focused on how the law is affecting healthcare at the moment, with the Affordable Care Act up for discussion in the Supreme Court. This story shows in a real way how, now that a lot of the forces of that law have been put in place, you're actually going to see some people benefiting no matter what the Supreme Court decides. These health IT companies are a very early example of how these legal changes can completely change the short-term path of an industry. Patterson, he's a Republican, big devotee of Ayn Rand, but he'll tell you that a lot of the things that we're debating there are set courses here. And he thinks that insurers do need to become less of a slice of our healthcare dollar. Right now they're 30%. He thinks that should be a dime. He thinks people need to have access to their medical health records. Cerner has been around for 33 years. They were founded by three guys from Arthur Andersen who were writing computer software back when that meant that you were going to a company and getting on their big old mainframe and figuring out how to write software for them from scratch. There wasn't a software industry yet. This is an effort that predates Microsoft. Neal Patterson has been CEO of Cerner from the very beginning. This has really been his show from the get-go. He can be a pretty tough guy. There's an email that is probably one of the most famous emails ever sent by a CEO that he sent to his employees, which was decidedly harsh, telling them that there needed to be more cars in the parking lot at 8 a.m. and after 5 p.m. and people weren't working hard enough. His idea that you could do software in healthcare just as you do in automobiles or financial services is what has defined this company. Patterson grew up on a farm literally in the wilderness on the Oklahoma-Kansas border in the 1950s. Went to college and went to Anderson actually because he said he thought that his world had been too small and he didn't want to pick an industry. He didn't want to just go work for big oil, which would have been the standard course. And that's how he landed in this kind of software area with two of his buddies from Anderson. Created this company, and it's taken a very long time. I mean, Cerner only became a billion-dollar company in 2005. They've more than doubled since then. But they're really only after all that time starting to gather a ton of steam now. Neal Patterson wasn't really a guy I'd thought about much before this story. He kind of came up because of the constant data tracking we do here at Forbes, that he was coming up on our best bosses list pretty consistently. Cerner was obviously growing fast, the stock was up. As a result of that, he's also a billionaire because of the huge amount of Cerner stock he owns. He controls about 15 million shares, which is worth more than $1 billion on its own. Because this is something that's kind of happened off to the side, they're in Kansas City, not in Silicon Valley or Boston or the pharma strongholds of New Jersey. Their competitor, Epic, is in Wisconsin. These are not companies that have been in the medical mainstream. That makes them very different, and that's making this process very different. Now, as they go through the nuts and bolts work of establishing electronic medical records, it could be that we're creating an environment where a lot of other companies might come into this space. The big question is whether this still relatively small company can really manage its way into becoming dominant in what's probably going to become a very big industry. Healthcare is changing in a lot of ways that are being impacted by the laws that are being passed in Washington, but some of the things that we think of as bound up with those laws very much aren't. There's actually a much richer debate going on in capitalism and free industry about how to fix these problems than you'd think from watching the legal wrangling.